Hello, my name is Gabriella Cavazos, and I'm a student in the Anthro 220 class. And today I'm going to be talking about eating disorders, specifically anorexia, and the causes and effects that anorexia has on people in society. First, I'm going to be talking about the main subject, which is anorexia nervosa, most commonly known as just anorexia, and that is characterized by low weight, food restriction, fear of gaining weight, and a strong desire to be thin. There are two more definitions that I thought were also important to add, which is the first one is lack or loss of appetite for food, such as like for a medical condition, and or emotional disorder characterized by an obsessive desire to lose weight by refusing to eat. Now we can go into what does it really mean to be anorexic. To be anorexic is to be a person with anorexia, is most often a girl or a young female, and they have a markedly reduced appetite, typically begins dieting to lose weight. And like I mentioned, it's typically a girl or young female, but as the slides go on, I do mention that men do suffer with anorexia, typically not as much as girls or young females, but it does happen in men. Moving forward, we could now look at the causes of anorexia and how typically it begins in a person. So first, it starts off by a person who perceives themselves to be overweight or concerned about their weight or shape of their body. Over time, the person consumes only a small amount of food over the courses of a day, which can lead to health risks such as malnutrition or starvation. However, we can also look at some psychological causes of anorexia. In some cases, people may have obsessive compulsive personality traits that make it easier to stick to strict diets despite being hungry. Also, some strive for perfectionism, which leads to thinking that they will not be thin enough, which also causes high level of anxiety. This next slide focuses on the effects that anorexia has on adolescents and teenagers, and these people who suffer can be at great risk for anxiety and depression in young adulthood. This can be present even after the person has been treated. There's increased risk of self-harmful and suicidal behaviors. Alcohol and drug abuse are also commonly done in the patients. There are also neurological problems as well, including nerve damage affecting the brain and or other parts of the body that can be temporary or permanent damage. And below, I list three bullet points of some of the effects that it can have on the body. And to the right, I have a picture going into depth about what anorexia can do to the body, and that includes damage on the brain and nerves, hair, heart, blood, skin, and much more. Kind of continuing the last slide, with the effects comes with health risks and treatment to this disorder. Some of the risks include low blood sugar, anemia, kidney and liver damage, loss of bone mass, and dehydration. And then also it goes back to the last picture that explained other issues that can be permanent or temporary. There are also treatments. Men who are suffering from this disorder initially do not want to be treated, even if the problem is recognized by the person. And that kind of goes back to the first slides where I talk about how a lot of people perceive themselves as not being thin enough. And so a lot of the times, a lot of patients do not want to seek treatment because they have this fear of gaining weight. However, there are also other many ways to treat this disorder if you are really concerned about yourself or another person's health. Below, I've listed just a few of resources such as online or in person, that can help overcome this disease. The first one is NEDA, Feeding Hope Hotline. Eating Disorder Hope Hotline is the second one, and McCollum Place Eating Disorder Center. It is also very easy to look up online. Different resources, other resources that work better for you, or you think that would work better for somebody else that you were concerned about. I also wanted to add some statistics. A lot of the times people don't know a lot of these things and just assume that it's either just in women or that it's just young people or it's just one thing. But I wanted to add some facts that I thought were super interesting and also super important. The first one is that anorexia typically presents itself during puberty, with 1% of American females between the ages of 10 and 25 suffering from the conditions. The second one is, like I mentioned before, is men suffer too. Anorexia largely affects the female population, which is, to get more in depth, 9 out of 10 females suffer. But a male can be considered anorexic when he restricts his intake of food as well. The third one is anorexia is the third most common chronic illness among adolescents, which is super high. And the last one is 20% of individuals who suffer from anorexia and do not receive treatment will die, which is also something that is super important as well. Because over the course, we do learn a lot about the specific and right nutrients that we do need for the body, and this is one of the things that is very serious, and getting the right nutrients and maintaining a well balanced diet is super important for our bodies, and that goes for everybody, not just adolescents who suffer from anorexia, but other diseases as well. While I talked about a lot of things that we learned over the course, I really wanted to relate this to Lecture 3, which is learning about energy balance. Along with the concern of eating disorders, there are many ways to be healthy, happy, and maintain your body weight. For example, energy balance is important because it calculates the right food and energy for your specific gender, sex, growth, age, physical activity, body composition, and size. And energy balance is defined as the energy, which is kcal or calories, consumed from goods and liquids compared to the amount of energy expended through metabolic processes and physical activity. There is a balance that can be very difficult. In this case, we're not talking about to gain weight, but to gain weight, you intake calories from food, and to lose weight, you output calories used for energy, which typically that's what a lot of people who suffer from this order do. They output calories and do not get enough intake from food. So there is this low balance of intake and output calories used for food and energy. This helps me relate because while anorexia hardly gains weight or the right nutrition and energy, you can also overeat and get excess amount of food that the body doesn't necessarily need either. This can be referred to as overeating or obesity, and that is clearly the opposite of anorexia, but I just wanted to add that because, like I said before, there is this unbalance of energy in and energy out. Which is body weight equals fat plus lean tissue plus water. Body weight and composition is defining body weight, and I have written down fashion, and in the lecture it talks about a lot of fashion magazines or a lot of television shows that promote this ideal body, and a lot of the times people who suffer from anorexia look at those things and feel like they need to look that way, or they need to eat what these specific people eat in order to look a specific way, which in this case is not typically the right thing to do. A lot of these times people do suffer with a lot of disorders, so it doesn't always look the way that it seems. And the first steps to healthy changes are change with time and between cultures. And time comes with, it could take up to years, months. Everything's not going to change in a split second. A lot of this time people want to rush the process, when in reality the first step is to just change your eating, change the way that you look at a lot of things, and that already is a huge step into overcoming this disease. Self-acceptance and learn what is really ideal, and that goes back to, like I was saying, about the magazines, the fashion models, the TV, the advertisement that a lot of these people look at for reference to look like, when in reality, just accept yourself for who you are. Obviously, still get that well balance of energy in and energy out, but at the same time too, don't really look for something that is not good for your body. Always look at things that are right for your body. And like I said, going back to the first thing about energy balance, is that everybody is going to have a different physical activity or composition and size. So in reality, when you are looking at these people, they're different. Your body's different from everybody, so it doesn't really help that. And just do what's healthy for you. Clearly getting the right nutrients, and allowing yourself to be healthy and to look healthy. Next, I'm going to relate this topic to lecture 10, which is medicine and undernutrition. And a few things that I got from this that I felt were necessary to add to this presentation in relation to anorexia. And the first one is undernutrition, which is also known as malnutrition, which is the inadequate intake of nutrients for survival. This is not necessarily starvation. So a lot of the times, it's just not getting the right nutrients for your body. A lot of the times, anorexia isn't completely starvation. It's just eating less or eating very minimal items, which is the diet that is very severe and change with regular eating. In this sense, this relates globally and to millions of people without access to food in different countries, but can also relate back to people who struggle with disorder, anorexia, because of the absence of food itself. So like I said, there are a few things that I wanted to add because I didn't feel like this lecture completely was focused to anorexia, but obviously to a lot of the people around the world, like I said, globally, who don't have a lot of access. In this case, a lot of people who suffer from anorexia may have more access than other people, but I still thought it was important to add that they are still not receiving all of the nutrients, and can relate to a lot of the people without food. And so some of the effects of undernutrition are growth failure, and that is really if you start at a young age, and that goes back to the slide where I state that anorexia is typically between the ages of 10 and 25, and then with growth failure, that just comes with combinations of undernourishment and infections, and then also it increases your risk of death. Lastly, I wanted to add that this relates to an article that we had read, which is titled Food Insecurity. And basically, this was an article conducted at a UC that examined some of the students who suffer from food insecurity. And what I got from this article was a lot of what stems the process of this eating disorder is food insecurity. And like I explained to in my last slide, this article doesn't completely target anorexia itself, but a lot of what comes with anorexia is food insecurity, because a lot of the times people are afraid of what they're eating and what they're putting into their bodies. And many women and men face this, where they're not satisfied with how they look. While students experiencing this, 11% of students were most likely to purchase food from fast food restaurants, according to the 2016 study, which is high. Something that a lot of times people do. Like I explained, obesity, anorexia, though that they are two completely different things, a lot of people with food insecurity tend to eat a lot or tend to eat very little. However, with eating too little or too much, food can also negatively impact diet quality through inadequate amounts of vitamins and minerals, leading to potential health risks. And that just, again, goes back to the whole energy with the intake and output of energy that you are using into your body, which can create health issues. And that just goes for malnutrition or just getting too much food intake, which can lead health risks for your body. Your body needs to stay healthy and get the right nutrients, vitamins, minerals, and everything to maintain a healthy diet and to maintain a healthy lifestyle. In this slide, I also added a quote that I thought fit perfectly with anorexia itself and kind of giving a breakdown of food insecurity in this article and how it helps me relate to anorexia. And then lastly, it's just like whether it be financial complications or lack of confidence, a lot of students struggle with this insecurity that can lead to serious health risks. And like I said, sometimes you may think that it is just like a personal thing, but it also can be very financial, which also can lead back to getting the right treatment for this disease and allowing yourself to be secure in the foods that you eat, and while also helping maintain that healthy diet.